Dr. Sajid, again. I have often been asked about allergies in children and in general. So, what does it mean when you say you are allergic? What it actually means is that a person overreacts to or is oversensitive or hypersensitive to a substance that the person may be exposed to. And these are called allergic individuals, and they are these substances that can come in contact with the body are ordinary substances, and they're generally not harmful, but in some they seem to elicit a reaction that is more than normal. So these are allergic individuals or individual children, allergic children, or sensitive children in some way. So how do these substances that we call allergens enter the body? They can enter, the commonest one is through the nose. For example, let's say dust. If child is allergic to dust, he gets it through the nose. It might be smoke, it might be perfumes, it might be smells, it might be chemicals, it might be smog, for example. And this may cause an overreaction in the body. And this is, of course, a reaction that our immune system or defense mechanism produces. Then there are substances that may be taken by mouth or ingested, as we call them. Ordinary substances, for example, milk is so vital, but some children are allergic to milk. Also peanuts, very common, and eggs, for example, very useful part of diet, but some children and adults will also be allergic to eggs. Or fish, for example, again a very good source of nutrition and protein, but some individuals and some children will be allergic. And then it may be something that is applied to the body, for example lotions, medicines, chemicals, etc., that we often use. Creams and lotions are used, soaps may be used. So what do we call this? This is what we call an allergic person. And how do we diagnose it or make a diagnosis? This child usually will get symptoms of like a runny nose and watery eyes and sneezing and sometimes coughing. So this is when it is taken in through the nose, and it is not difficult to recognize, and especially if this happens at a time when a child is exposed to, for example, dust, then it's easy to tell. Or there is a change in the weather, for example, changing seasons, then it's easy to diagnose. The substances that are taken by mouth, you could be allergic to also, for example, like I said, milk or eggs, etc. And that might also, in addition to this, may produce pain in the abdomen, or it may produce vomiting, etc. So these are symptoms. That is how you sort of figure out that there's something wrong with the child and you take him to the doctor. So what does the doctor do? He will take a very careful history, which means that he will go over the situation in the family. Invariably, allergies run in families. So one parent or both parents or somebody very close to the child, closely related to the child, may have allergies, maybe cousins. And then there is a greater chance that this child may be allergic. So he will also do a physical examination, look at the pale eyes, the pale lining of the nose, and also examine not only the ear, nose, throat, but the rest of the body, the skin, and check the vital signs, etc. So sometimes tests are necessary, and these tests may involve blood tests, and that will tell us the level of allergy in a child. Oftentimes these are not necessary. It is like I have mentioned in one of the previous clips, some of these children will also have spasm and start wheezing or whistling. So the diagnosis is made by finding out how it evolves and the examination, and sometimes some tests. And the treatment is given to the child depending on what he is allergic to. So the best thing is to avoid it. So if it is dust, you avoid dust. If it is a pet, for example, a cat or a dog, you avoid it, or it's a parrot, you stay away. Or if it is something that the child eats, like an egg, then you should avoid it. So best is avoidance. So first is to determine what the child is allergic to, and second is to avoid it. Of course, there are times when you need to take medicines, and most of these medicines are antihistamines. Histamine is a chemical that is released when a child has allergies. So these can be given in the form of syrups, and there are other nasal sprays that can be given that invariably include steroids, but they have to be given for short periods of time. And very rarely, if the allergy is very severe, you may have to undergo testing and then take shots for these allergies. So the best thing is to understand it and to try and find out what the child may be allergic to, and the best is prevention or avoidance.